Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today is Dr. Lavergne Andre, and she's a podiatrist, a foot doctor.
That's correct.
And she is also the owner and operator of Loving Hands Podiatry. Today, we're going to have a lesson on the feet. Welcome.
Thank you.
Now, what do most people come to you for? What foot issues do they come to you for?
Most often people come to me because they can't cut their toenails anymore, or they may have painful calluses at the bottom of their feet. They may have a corn. They may have a wound at the bottom of their feet. They may also have plantar fasciitis or Achilles tendonitis. These are very painful conditions that a person realizes they have an issue when they first get out of bed and they can't hardly walk, or they are sitting for a period of time and they go to stand again and they feel an intense pain in their foot.
Now, I've heard of plantar fasciitis with athletes. Anybody can get it, though.
Anybody can get it. If a person is overweight, if they recently gained weight, if they change the shoe gear they're wearing, they go from wearing heels to wearing flats. The Achilles tendon and the plantar fascia needs to be in perfect balance. So this heel bone acts as a fulcrum for both of these tendons. And when one is tighter than the other, that imbalance is what causes the pulling away of the plantar fascia, and it causes intense pain.
Now, it's been my experience that foot issues, especially if you're dealing with tendons, they take a while to heal. Why is that?
That's because you're dealing with small fibers. And most of the time, people don't do what they need to do in order to get the healing that they need to get. What I mean is 90 to 95% of plantar fasciitis can be cured by stretching and stretching properly and stretching religiously. So if a person does their stretching exercises properly for the proper length of time, 90 to 95% of them will get better. There are other things, other protocols that we put in place to treat this condition, and most of the time, if those are followed, then they won't need to go on to having surgery or anything else.
The other protocols that dealing with anti-inflammatory?
Yes,
medicine?
Anti-inflammatories, injections of anti-corticosteroids, anti-inflammatories. You could take oral anti-inflammatories. A person can wear an orthotic, which is an arch support, which is going to support their feet. They can have physical therapy, laser therapy, shock wave therapy. There's a whole host of things that can be used in lieu of having surgery.
So the thing is that you've got to do whatever it is as far as the treatment goes on a consistent basis.
Absolutely.
You can't do it until it feels better and stop, which
That's
is
correct.
what I did.
That's correct.
And this thing went on for like 2 years. So I definitely understand. You also deal with something called neuropathy. What is neuropathy?
Simply stated, neuropathy is nerve pain. It is when the nerves on the outside of your body, the peripheral nerves, are not sending the signal to your brain that there's something wrong. Most people, if they're stepping on a rock, they could tell they're stepping on a rock. If they're stepping on something hot, like in the summertime when you're on the sand or around the pool and it gets too hot, you're going to feel that. Or you go to take a bath and you put your feet in the water, you're going to feel that it's hot. If a person has neuropathy, they don't feel that. It starts with the senses. They're not able to feel hot or cold. They're not able to discern what surfaces they're walking on, whether they're walking on carpet or tile or hardwood floor. If they're walking down the steps, if they're driving, they don't know the difference between the gas pedal and the brake. So these are parts of neuropathy where it becomes dangerous for the person. They'll realize they can't feel where their feet are in space, and they'll have a tendency to fall. And these falls can cause them to break bones, which can cause them to go into the hospital, which can cause an amputation.
Where does this come from?
Well, neuropathy is caused by several different things. 1/3 of the population who has diabetes can get neuropathy from the process of diabetes. Diabetes is when your sugar, your insulin levels are not in control. And when they're not in control, they affect your eyes, they affect your kidneys, and they affect your feet. Diabetes is one of those very serious illnesses that is now similar to cancer. When a person has cancer, you think of that as a death sentence. Most of the time when a person hears that they have diabetes, oh, they have a little bit of sugar and they keep on doing whatever they were doing.
Because it's a silent disease.
It is.
And you said that's 1/3. What about the other part of the population? Where else, what other people come down with neuropathy?
People who've had chemotherapy can also develop neuropathy. People who drink excessively can develop neuropathy.
How does that happen?
When a person drinks a lot of alcohol, their bodies aren't able to metabolize all the alcohol that they're consuming. So it has a neurotoxic effect on the body, meaning that it's toxic to the nerves, and they no longer are able to feel. It also depletes some of the vitamins. So a person gets depleted in vitamin B12 and vitamin B6 because of all the alcohol that they're drinking.
And that can result in?
And that could result in neuropathy.
What treatments are available?
There are a lot of different treatments for neuropathy, as we hear on television all the time. There's Lyrica, there's Neurontin. These are pharmaceutical ways to treat. They're only effective 30 to 40% of the population. They are in the category of opioids, and we know what's going on with the opioid epidemic right now. So seeing that they don't cure your condition of neuropathy, they only mask the symptoms, and they have all these side effects. There are other treatments that are more natural that will not necessarily completely take away or regenerate the nerves, but they can take away that pain and numbness. Alpha-lipoic acid with a combination of your vitamin B6 and your vitamin B12. There are other natural remedies for neuropathy. But one of the devices that I use that I came across a couple years ago is this device here. It's a Synexus machine. It is a way for people to receive neuropathy treatment in the comfort of their own home. This delivers an electrical signal to their feet, because that's what I'm a podiatrist, so I treat their feet. The signal is safe, it's non-invasive, and it's highly effective. Up to 87% of people who have neuropathy, once they are treated over a course of 8 weeks, twice a week, they are able to sleep better. They're able to feel their feet once again. They're able to go from, they're able to drive. They're able to resume their activities of daily living.
So how does that, do you strap these on, or something goes on the bottom of your feet? How does that work?
Yes, exactly. So I don't have the straps here or the leads here, but we do strap something on your feet. This is not the same kind of therapy that you would receive at a physical therapist. This has over 20 different modalities. So each week you're getting a different treatment so that the nerves don't get accustomed to the electrical signals that it's receiving. And that's how it's actually able to regenerate the nerves.
So it's twice a week for 8 weeks. And
Yes.
how long does this last? If you receive this treatment, do you have to go every year, every 2 years? How long does it last?
We usually check you again after 3 months, and then after 6 months, and then after a year. Most people don't have to constantly get the treatment after that period of time, but everybody's different. Some people are on 1 diabetic medicine, some people are on 3.
So you're saying that whatever medication you're on may affect the effectiveness of the machine?
No, what I'm saying is everything doesn't work for everyone. So with the 87%, that leaves 13% that don't feel any positive effects. And where that 87%, some people receive a longer benefit than others.
Oh, okay, okay. And so after this 8-week period or whatever, are there other issues that can come up? Are there any side effects involved?
There are usually no side effects with this treatment regimen. And that's one of the things I like about it. It's non-invasive. It's not going to affect any of your other organs. As a matter of fact, this machine can work for a variety of conditions, not just neuropathy in the feet, from headaches to backache, sciatica, drop foot. It has a lot of different treatment regimens that can be used effectively to treat various conditions and various problems.
Now, you do something that's very rare, that I haven't heard of since Dr. Welby, MD, back in the 70s. You go to homes. You treat in home.
Right. That's right. I've been doing that.
As much as I hate to go to the doctor's office, you treat at home.
That's right. For 32 years, I've been doing house calls. My territory is not just Prince George's County. I also go to Anne Arundel, Washington, D.C. I've gone as far south as Chesapeake Beach. I've gone as far west as Cabin John, as far north as Catonsville and Baltimore County.
So you go to the Baltimore, okay.
Yes. So I cover a wide area.
And what would a home visit include?
A home visit would include an examination. I would tell the person what conditions I have found. A lot of times the person will say, well, I just need my toenails cut. Well, under that toenail could be an infection. You could have corns or calluses. You could have tinea pedis.
What is that?
That's athlete's foot.
Oh, okay. Boy, a fancy name for good old-fashioned athlete's foot.
That's right. You can have an ingrown toenail that requires surgery, surgical correction. So to the naked eye, to an untrained professional, a person will say, oh, I just need my toenails cut. But a whole lot of other things can be going on in a person's foot.
Let's talk about the toenails. What is that when there's the yellowing of the toes and the toes get hard? They're almost like wooden nails.
Yeah, so some people actually develop a fungus. A fungus is an organism that grows under the nail. Sometimes it's superficial, it's a yeast, and there are over 100 different organisms that can be in a nail. Now there's genetic testing, so you could actually tell what organisms there are in the nail. And a lot of people say, well, I went to a doctor and they gave me XYZ medicine and XYZ medicine didn't work. Well, that medicine may not have targeted the particular fungus that is in your nail. So that's why it didn't work. Or it might not have been used long enough.
Well, is that genetic or it's just something that happens? Is it environmental? How do you get this fungus?
Personally, I believe it's hereditary. I just went to a conference last week and a well-known infectious disease person confessed that he had a fungus infection in his nails. And he had been married to his wife for over 30 years. And she doesn't have it. So to say, a lot of people say, well, you could get it in the shower and you could get it here and there. I personally don't believe that. I believe it's hereditary. If you have a tendency to have it in your family, your grandmother had it, your mother had it, your father had it, you can also have a fungus. And it's not because you share the same living environment. I believe it's more passed down than spread environmentally.
But as far as athlete's foot goes, as we head towards the summer and people are walking into showers, you go to the beach and you walk into a beach shower, or you're away from home and you're using showers in hotels and things like that. How does that work? Can you get a athlete's foot from that?
I believe, in my experience, you could get warts from those environments. But as far as getting athlete's foot, no. And I say that because I have had athlete's foot. It was on one foot and not on the other. And when I take a shower, I use both of my feet everywhere I go. So if it was passed in a shower situation or, walking barefooted wherever, which I usually don't do, by the way, I would have it on both feet and not just one foot.
Well, why not walk barefoot? I mean, I guess the reasons are obvious, but it is so much fun in the summertime.
Yes. So, like I said, if you have neuropathy, you're not going to be able to tell whether or not you're actually injuring your feet. I had a gentleman years ago who came to me on a Monday after walking around a pool. He had no idea that he had burned off, and I mean third-degree burns on the bottom of his feet until he saw blood in his shoe. So when you have getting back to that topic of neuropathy, you don't always know that you have it. And you could step on something. You could step on a piece of glass, you could step on a toothpick, and you would have no idea that that's on the bottom of your foot.
How about the average person walking without shoes? There are still lots of dangers involved in the feet.
Absolutely. An average person could still step on a piece of glass or step on a toothpick or anything, and that could get lodged into the bottom of their foot. They may or may not know that they have it, and then they'll need to have it excised. They could try to take it out themselves, which they try to do, and then leave a piece in there. That could form an infection, and there's several layers to the bottom of the feet, so you have complications from that.
Let's go back to the toes and the treatment. How do you treat infections in your toes, that yellowing of the toes? You see commercials on nowadays about how your toes can be lightened, your toenails can be lightened. How effective is that stuff?
Well, first of all, you should see a podiatrist. When you see a podiatrist, they'll let you know whether or not it's a fungus, or a yeast, or if it's a bacterial infection, because it could be pus. You could also have cancer, melanoma in your nail. So there are a lot of different conditions that a person can have in their nail, and they will have no idea if they don't go to see a podiatrist, and the podiatrist actually looks at it, biopsies it, takes the scraping of it, and lets you know what condition you actually have before you try a treatment.
So better safe than sorry.
Absolutely.
Making sure that you get your feet checked out. What are some of the other issues you deal with foot care?
One of the other issues are corns. Corns are on the skin, and a person says, well, I had it trimmed down and it came back. The reason it's come back is because it's caused by the underlying bone. The underlying bone is being protected by the skin. Now, sometimes people try to treat it themselves. They will try to shave it down themselves or get a commercial product that has an acid pad and put it on there and actually cause more harm than good.
Really?
The acid pad moves around. It can get on good skin as well as bad skin. And if that happens, you could form an ulcer on your toe, which is a hole on your toe. So not only are you dealing with the painful corn, you have to worry about the hole that's in your toe.
Where do corns come from?
Corns come usually from an abnormal bone structure. You could have a hammer toe, you could have a claw toe, you could have a bone spur. And all these are what contributes to a person developing a corn.
I haven't heard the term hammer toe in years. I thought one of the ways that you could get corns are wearing shoes that are too tight. Is that true or is that a myth?
Well, a shoe that's too tight is going to cause your toe to curl up, for lack of a better term. And when that happens and your toe is rubbing against the shoe, it will aggravate a corn because the corn is there to protect the underlying bone. So it's going to form on the skin to protect the underlying bone.
Let's talk about foot care when it comes to using lotion. How important is it to use lotion on your body? And we're not saying any particular brand of lotion, but how important is it to moisturize?
It is very important, extremely important to moisturize. Your skin is an organ. It is the first line of defense against infection. And just by putting lotion on will prevent your skin from cracking and opening and breaking down. And this is especially important for people who are diabetic. As we age, our skin has a tendency to get more dry and more thin. If you see a person in a nursing home or assisted living facility, you might see a lot of bruises on their skin. And that bruising is not because they're being ill-treated, it's because their skin is so fragile and the blood vessels on their skin break very easily. So by moisturizing their skin, you're helping to keep their skin nourished, intact, and prevent it from breaking down.
And when your skin is broken down, that means you'll more likely get an infection.
Absolutely. You could get an ulcer, especially if you're diabetic. But there are people who are not diabetic that develop ulcers as well. They may have poor circulation. If a person has poor circulation, their blood flow to their feet is not the way it should be. And that brings in atherosclerosis. When you have too much fat in your arteries, that could block the flow into your feet. So that's one of the reasons why when you see a podiatrist, they check your pulses. When I take care of my patients, say, what are you doing? I'm checking your circulation. Oh, do I have blood flow down there? Absolutely, and you better have blood flow down there or else you could have a whole host of problems.
I grew up and my mother would always say, make sure you put on lotion because you have ashy skin. And we just grew up just always making sure, always being told, you got to put on lotion so you're not ashy. But there's something to that. That's not just a wives' tale.
Absolutely. And I might hasten to add, as it's summer and we're going to be wearing sandals and flip-flops, that we should put sun protective lotion on our feet because, once again, we could develop melanomas and sarcomas and basal cell carcinomas on our feet as well.
So you've got to take care of the feet, because I was thinking in the summertime with the heat and the sweating, you don't need the lotion as much.
Oh, absolutely. You have to protect your feet even more so in the summertime.
That is definitely good to know. Do you deal with mostly seniors, senior citizens?
I do deal with mostly seniors, but I also see children. I've seen children for ingrown toenails. I most recently saw a child who was very active in sports for a condition known as calcaneal apophysitis. Children's bones are not together until they become an adult. That's how they're able to grow. That's how they're able to go from being a little baby to being 6'9". So when a child participates in sports a lot, they can develop a condition called calcaneal apophysitis, which is an aggravation of the heel bone. And the treatment for that is rest. Another thing I want to say about children's feet or young people's feet, one of the styles is to wear your sneakers untied, which does not allow the correct support of your foot. And if your foot isn't supported correctly, then you can have foot pain. And by simply lacing up your shoes, your foot pain will go away.
So do you hear that? Tie your shoes.
That's right.
Like you said, it's fashionable.
Yeah.
What about sandals on your feet?
I usually recommend certain brands of sandals for people during the summer months because you have to support your feet. Wearing just your regular $1 sandals that you buy at the dollar store or wherever you get them, those do not support your feet at all.
Also, because we're going to have to wrap up in a minute, but I've got to mention too, getting the right shoes for running or whatever physical fitness you're going to be.
Absolutely, absolutely. There are minimalist shoes, there are maximalist shoes, but your feet are your feet. So just because the latest and greatest thing is out there doesn't mean that you could wear them and that they'll be best for you. And I would also like to talk about socks very briefly. Socks are very important to wear. It was an old wives' tale to wear cotton socks. Cotton socks are not breathable. So once they get wet, they're wet, they keep your feet wet. You want to wear a sock that's made out of a variety of materials so that the moisture that's in your feet is wicked away to the sock and your feet stay dry.
Also, for people who have diabetes, sometimes the lines in the socks
Yes.
can be painful for
Right.
them.
Right. So you want to wear, there are a lot of different socks out for diabetics now. You could get them anywhere. You could get them at any generic store. So I like to recommend socks that are non-binding. They're not going to cause you to have a line around your ankle when you take them off. These particular socks have a silver sole, so that these are also antifungal, antibacterial, and they're made out of different materials, so they are moisture wicking as well.
What do you feel about the copper socks, the support, well, not the copper socks, but the support socks that supposed to give you support if you're on an airplane for a long period of time?
They're indispensable. There are so many people that have blood clots, develop a blood clot in their leg. So if you are traveling, if you drive long distances, you're a truck driver, or you just, whatever you do, if you're a nurse, if you're on your feet a lot, athletes are now wearing these support socks. I think if you can wear support hose, definitely wear them.
Very good. It's been a good show. I've gotten a lot of good information from you. So in wrapping up our discussion, socks are a definite.
Yes.
Support socks are a definite.
Yes.
And also you make house calls and you travel far and wide.
Exactly, and I am seeing new patients every day.
All right, so we'll make sure we put your information as well as your website on the credits.
Thank you so much.
Thank you so much for joining us. We've been dealing with Dr. Lavergne Andre, and she's a podiatrist and the owner of Loving Hands Podiatry. Hands and feet. It should be loving hands and feet.
That's right.
You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day.